y'all know how much blood is in the average adult human body?
No.
Well, it's about 5 to 6 liters. So that's about 2.5 to 3 of these guys right here. And it can take about 5 minutes to lose all that blood in a traumatic event. The problem is the average emergency medical response in the United States is about 7 minutes. 40% of trauma-related deaths are due to blood loss, losing all that blood right there. As a paramedic, I feel very passionate about learning and teaching people how to stop the bleed. There's also a group called Stop the Bleed, and it's an organization that's trying to teach the public how to stop blood loss. Today we're going to learn about the 3 types of blood loss that you can happen and how to control this blood loss. I hope that you all learn and listen, and someday you can save the life of not only yourself, but somebody else. So let's start with the 3 types of vessels in your body. So the first is a capillary. When a capillary gets injured, it's very minor, and I'm sure you all had an injury like this before. The blood loss is considered oozing in nature, and it's not a lot of blood. The second is your veins. So your veins pump all your blood up to your heart. So the bleeding can be a little worse, and it can be kind of hard to control. Vein blood loss is usually from deep cuts, and it's normally dripping or streams, and I'm sure some of y'all have seen that as well. The last is an artery. The arteries are the biggest vessel, and they could transport blood from your heart to the rest of your body. They're very powerful. So if this gets injured, it can squirt bright red blood, just like what you see on the movies. This is very dangerous and very hard to control. Well, hardish to control. And it can be due to any kind of trauma to your arteries. It's just bad placement, honestly. Also, it can be due to gunshot wounds and stab wounds and really any kind of major trauma. So, now that we've learned about our 3 vessels, we're going to talk about how you control this bleeding. So first, we're going to talk about capillaries. So like I said, capillary blood is the oozing, and it's as simple as a Band-Aid. A Band-Aid will put enough pressure on it to just stop that bleeding, and it should be done. Band-Aids are great. Second is your venous, your veins. So vein blood can be a little harder to control, like we said. It can ooze, it can squirt, it can just drip and drop. So what you can do is just apply direct pressure. So direct pressure is just firm pressure on the injury. So what that does is it kind of occludes, like shuts down that vein a little, so your normal mechanisms for clotting can kick in and clot on its own. So you can use your hand. However, if it's a stranger or somebody's blood you don't want to touch, I wouldn't recommend it unless you had gloves, because I don't want to get up in anybody's blood. You can also use it to control it as anything like a towel or a shirt or a paper towel. Sometimes a Band-Aid works, but not really. And also, the best thing is gauze. Gauze is absorbent, it can be sterile, and it's medical approved. So when this bleeding slows down after you're applying direct pressure, you can just tape it down, and your tape will do direct pressure, but your hand and the control is the best way to do it. So next, we're going to talk about arterial bleeding. So arterial bleeding, like I said, is a little more difficult to control, and what we're going to use is a tourniquet. Now, people can make tourniquets out of belts or shoelaces or anything else, but this is the best way because it won't cause any kind of nerve damage. So what a tourniquet does is it occludes the vein as hard as it can, and then it'll stop the bleeding. It's really tight, it's really uncomfortable, but it's better than the alternative of bleeding out. So what you do is you take your tourniquet and you want to put it above the wound. So it's mainly arterial bleeding on the extremities, because you obviously don't want to put this around your neck. So you just put it above the wound, you tighten it down, and then you twist this to tighten it down a little more. Like I said, it can be uncomfortable, so I'm not going to tighten it all the way because I don't want to be uncomfortable. I already am. So after you do that, you just leave it on, and you want to crank it down enough so the bleeding has completely stopped. If it's oozing a little, that's okay, but the idea is to make it stop all the way. Sometimes people need 2 tourniquets, but 1 is usually enough. Tourniquets save lives. We carry them on ourselves as paramedics. The police officers in Denver carry them, and the firefighters, in Denver also carry them as well. So now we've learned about the 3 types of bleeding and the vessels. Remember, capillary veins, arteries are the dangerous ones, And we've talked about how to control them with tourniquets and pressure on your wound as well. So I hope you learned something today, and maybe someday you can use this to save a life. Thank you.